ઇન્ટર હતો હોય તો નામ કાઢો એટલે 4 વાગે નામ લગભગ 5 મિનિટ ફટાફટ ગાડી શૂટ.
Hello, guys.
Hello.
So, yeah.
All
Yes,
set, sir?
yep,
Okay.
all good. So, okay, people are still joining, and should we wait for two more minutes? Everybody all right with that? We'll just wait for 2 more minutes and then we'll start our webinar. In this webinar, I'll be talking about uh, our course and all the things I'm going to provide and how you are going to prepare when you're enrolled in our course and everything basically that you need to know about our webinar. Um, can you guys still see my PowerPoint? Can you see it? No. Okay. Smear, I made you host. Can you please make me host again?
कर दिया. Done.
Okay. Cool. Okay. Now, presentation. Can you see my presentation? Okay. So, so guys, welcome to this webinar. In this webinar, I'm gonna talk about our AMC course and all the things I'm gonna teach you in this course and what's the timeline and what's the expense and everything. So just bear with me. So many of you guys might be knowing me from my Instagram, YouTube. So I'm your host and your mentor, Rajat Gupta. And these are the mentors about our AMC2 course. We have 6 mentors, and these are the qualifications because I have seen so many coachings. They are teaching you guys even if they don't have that experience or they haven't even cleared the AMC exams, they are teaching you. So I don't know how it works, but yeah, for me, the quality is something I believe in. So yeah, okay. So these are the mentors. Let me introduce. That's me, Rajat Gupta. I have done my MBBS MD medicine from India and clear MRCP AMC1, and now I'm working in Queensland Health as a PHO. And Arushi Rana, my wife, she cleared MBBS. She did MBBS from India and then PLAB exams, AMC1 as well. She initially worked in UK for 1 year and then she moved to Australia. And it's been 1 year she's working in Australia and she's gonna start her medicine training this February. And next is Dr. Gurikbal. He was my college senior. He did MD medicine. And for the last 5 years, he has been working in a corporate hospital in India as a consultant medicine. And now he cleared AMC1 recently and moving to Australia this January.
मिस 20 2 दिन ये और
Uh,
11 इस महीने के बचे हुए
Guys,
13
can you please mute yourselves? I'm not very sure who's talking, so yeah. Next is Dr. Injin Shuran. She is my batchmate. She did her MBBS from Government Medical College in India, cleared AMC1 English exams. She has been working in corporate hospitals in Delhi for last 5 years. And Dr. Arpi Shukla, he's my friend and colleague. He's working in the same hospital in Australia where I'm working, and he has a very special interest in surgical branches. So he's gonna be teaching you guys in surgery field here. And last but not least, Dr. Bhavya Malhotra. She did her MBBS from India, cleared AMC1 and PESCI exam. In our future webinars for our students, we'll be conducting one more webinar. So for all the candidates who wants to become a GP about the PESCI route, Dr. Bhavya will be leading that webinar. And she did her fellowship in emergency medicine and critical care in India. And after she also worked in OBS and Gynae for last 2 years. And now she's moving to Australia in February or March. I'm not very sure. So these are your mentors. So these are the chosen mentors they will give you the crust and how to crack AMC1 with AMC1 is not about hard work. It's more about smart work. So the same content will be teaching. You can find it anywhere on all the coachings and all the notes, books. Everything is same, but the way you study and way you read the content is it's what finally matters. So we as teachers, as your mentors, gonna teach you how to get your studies focused and clear your AMC1 in your first go. So yeah. So the course timeline, this course is gonna start on 15th January, and by the end of 15th March, by the end of 31st March, we are gonna cover whole syllabus. Our target is to take 2 sessions every week, but we might take 3 sessions if we are lagging in syllabus, but we have to finish the syllabus by 31st March. And each session will be around 2 hours. So almost 50 hours minimum teaching will be done. In these 50 hours, we'll be covering full AMC syllabus. See what's going to happen in each session. So, for example, me and Dr. Gurikbal are going to teach about medicine. So, we will be dividing the syllabus. Like some topics I'll be teaching, some Dr. Gurikbal will be teaching. So the topics I'm gonna teach in my session, I'm gonna teach about, for example, cardiovascular system. And then while teaching, I'll be telling you guys, okay, this is a recall question from this topic, and this is a high yielding topic because so many questions from this topic is coming. And so the session is not about just giving you notes or something like that. We are gonna teach you simultaneously like what kind of questions they are asking from those topics, and we're gonna cover some recalls while we are teaching you guys. And we'll also provide you with the PDF notes we are teaching from. But I would highly recommend when we are teaching you guys, you make your own notes, because if uh, because if you're making your own notes, that will stay longer in your brain. So you don't have to go from your PDF or anything, just a handwritten notes. That's a must. That's what I did. That's what your mentors did. And that's what made a difference when you're sitting in the exam. So don't just read from the your PDFs or maybe books. Make your own handwritten notes. That's why this uh, course is just 3 months or 12 weeks. So yeah, that's the whole point. But if some of you want PDF notes, I'm happy to provide that. Yeah. And next is we're gonna provide you with the books, whether it's red book, MCQ it's gonna be blue book, and John Mothag PDFs and everything. And just in case if you miss some lectures due to your shifts or duties, we will be providing you the recorded lectures. And plus, we'll be giving you WhatsApp support with the mentors so that if you have any doubts, you can ask them. And meanwhile, I'll also be hosting webinars for my students, like how to prepare well, like maybe in the middle of the session after 6 weeks or whenever you guys need. I'll be guiding you throughout so that you don't lag behind or you don't divert your focus from AMC1. So yeah. Next is mock exams. We're gonna conduct 3 mock exams, out of which 2 will be mini mock every 4 weeks. And at
Hey,
last,
Drishti,
sorry,
please mute.
who's mute?
Ask
Okay,
Drishti
so
to mute.
yeah, please everyone, don't disturb others. Keep your mics on mute. In the last, we'll be having question answer round so that I will be able to answer your questions. So yeah. We'll be conducting 2 mini mocks every 4 weeks. We'll be conducting 1 mini mock. So 2 mini mocks, and at last, when we are done with the syllabus, we're gonna conduct a grand mock exam in which it will be like AMC1 like exam. So you'll be taking that exam and we'll evaluate your knowledge after the course. Plus, once we are done with the course, and mock tests have been done, we'll be conducting a 2 week crash course, which is gonna be totally free for the students who are gonna join our course. We'll be taking 5 sessions, 1 session by each faculty. For example, Dr. Bhavya will be conducting gynae session. So she taught gynae in the our AMC1 course, and then after finishing the syllabus, after the exams, we will conduct a session with gynae with Dr. Bhavya covering gynae recalls, gynae high yielding points, and the topics you were lagging in your exams. So these are the things we're gonna cover in our these crash course kind of session, 5 sessions and almost 10 hours, maybe more than that. It depends how good you guys perform or bad you guys perform. If you are not enrolled with our AMC1 course and still want to be a part of this crash course just before your exam, it's gonna charge you around 200 Australian dollars. So it's totally up to you. If you want to go with AMC1, it's free. If you are already prepared, or maybe you took some coaching and you just want to brush up your concepts and you are taking your exam in April or May, so this might help you. So yeah, that's what we can offer you. It's gonna be 5 days straight. Every faculty will be conducting 1 session. So that's a bonus for my students. Fee for this course is 799 Australian dollars, and for your information, it's not the US dollar, it's Australian dollars, which is around 55 Indian rupees. So yeah, but the good thing is you can pay it in 2 installments, 400 beforehand when you start the course, and 400 after 1 month when you are in the middle of the course. And we are also offering for group discounts if three or more than three friends are applying for this course altogether. So you're gonna get some more benefits. So yeah. So the questions I got, there were so many questions, but the questions that were relevant to this webinar, somebody asked the career gap. So even if you have 1 or 2 years of career gap in the past, doesn't matter, because for you must have recency. For recency, you have to work minimum 3 months when you're applying for jobs. For example, if you are preparing for AMC1 and you are not working, doesn't matter. As soon as you are done with your exam, start somewhere, even in private, government, doesn't matter. Join any hospital, and anyways, you're not gonna get a first job in maybe first interview in 3 months or 4 months. So by the time you'll get your first interview, you'll have 3 months experience. So that's what they need. It's called recency. So you don't worry if you are already dropped 1 year for your NEET PG preparation, or maybe you are not doing anything. Doesn't matter, but you need to work for minimum 3 months before applying for jobs. Second, target time for applying this AMC exam. If you are enrolling with our course, we are gonna finish it before the April slot, but I would suggest you to book your exam for May or June. Why? Because once we are done with the course, you'll have your own notes, you'll have your own material, you'll have our guidance, but you need self-study of your notes again and again and again. That's what you're gonna make you stand out from others. So don't just go straight away in April. Don't book your exams in April, because on 31st March, we're gonna finish your this material. You'll be having your own material. Just take 1 or maybe 2 months to read through those materials and do the practice questions and everything. So that's how we're gonna book the exam. And when to book the exam, like in time frame, we'll be talking in our next webinar. Once you are done with the once we start the course, we'll be telling you how to book the exam so that we can get better recalls and more chances of passing. So these are the trick things. I'm just saving it for my students. Third, the campaign opening. So somebody asks when they are opening the campaigns. For Queensland Health, the job application starts in July and January. So if you are applying for your exam in May or June, then by the time the campaigns open, you will have your AMC1 results and you can start applying. But it's not short. So all the states have different time frames for their campaigns for jobs. So you just keep looking, or maybe we'll be updating in your WhatsApp group like these campaigns are open. And see, our target is not about earning, because this amount is not for earning. This is the expense, because we have to give it to the faculty, to the team that is managing all the editing and website and all the stuff. This is just to make a difference, because the similar course from other coachings costs around 2,000 to 3,000 Australian dollars, but that's not very pocket friendly. So I wanted to give you guys something that you guys can have, and just a small support from my side that I'm gonna do. So yeah. Other questions like cost of AMC exams, how to do the PG in Australia and everything. All these videos are available on my YouTube free of cost. I'll be sharing the links in the last. Otherwise, just search Dr. Gupta MD on YouTube. You'll find all my videos. So go watch this video. And the other question, whether you need a degree before applying for AMC. Yes, if you're a final year student and you are an intern, you need to have your degree, because we need EPIC verification before applying for AMC1. So if you don't have degree, you can't apply for AMC1. But yeah, you can enroll in our course and make your own notes beforehand, so that when you apply for your exam, you don't have to struggle a lot to get your content ready. It's already cooked, so just serve it. Now, your questions. You can ask one by one. I'm happy to answer. but just make sure that these questions are related to our course. If you have any doubts about our course, I'm happy to tell.
Good evening, sir. My name is
Yes, yes.
Shweta.
Yeah.
I am sixth year student. I'm doing my medicine from Uzbekistan.
Mhm.
Sir, actually, I wanna do AMC, but I'm in sixth year first semester. I will get my degree around September,
Mhm.
August or September. So should I clear my FMG first, or should I? I don't wanna be in India after my medicine, like
Okay.
after my degree.
So I have posted a video about FMGs in Australia. So some of your colleges are already recognized by Australian Health, like APRA. So you search your college there. If
Yeah,
it is,
I did, sir. I did.
yeah,
It is.
yeah,
My university is.
yeah, that's great. Then you can directly apply for EPIC verification. Once you get your degree, get your EPIC verification, and you apply for AMC1. You don't have to go for FMG exam.
Thank you so very much, sir.
Ah,
Sir,
no.
so one more question.
Yeah.
After this course, there will be other course also, right? Like after 31st March, it will be over.
Yeah.
Then the second batch will start, right?
Yeah, we'll start other batches as well, unless I'm in my business goes down. So if you guys are with me and people are joining, I'm happy to continue doing this. But I can't afford to have so many sessions without any students. So yeah, hopefully
Yeah.
yes.
You are an inspiration. Thank you so very
Thank you,
much.
Sheda. Thanks a lot. Yes. Anybody else has a question?
Hello, sir. I am Raghav
Hi,
from
Raghav.
I'm Raghav from India, and I'm in my final year of MBBS, fourth year, and we have our exams in February, in the start of February and March. So unfortunately, I cannot join this course because I'm preparing for my final exams. But I really want to pursue for the.
Yeah.
So
Yeah.
what do you suggest we should do?
So
Like
so
I
Raghav,
would start my internship in April.
So, Raghav, it is a very good time, but at the moment, you focus on your final exams because they are very important. So, you clear your final exams, but as soon as you start your internship, just get into a course and make your own notes. I have also posted a video about how to prepare while you are doing your internship. So, if you have the content ready in maybe, for example, you are starting your internship in March or April, you join our course at that time and you get your notes ready and you repeat, because only key, it's not about AMC, guys, listen carefully, very carefully. It's not just about AMC1 or AMC2. NEET, PG, PLAB, all the exams, any exam in your life, unless you repeat your revisions with your own handmade notes 3 or 4 times, you won't retain, you won't recall. So even if in your exam you are looking at the question, you'll say, okay, I have read about it, I have heard about it, but you are not having that memory in your brain, like what's the answer. So for that you have to repeat your notes, make your own notes. So that's the key. It's not about the course, it's about something I wanted to share with you guys. So yeah.
So, sir, if we want to join in the April, the course would still be available, right? It is not
So
that it's just the
this
one time
this
thing.
course ends in March, 31st March, and after that in mid-April we'll be launching another course. So you can
Okay,
join
so
that
we'll
one.
we'll definitely
Sameer,
join.
yeah. Sameer, I shared the, sorry, I think I can stop sharing the, give me a second.
Hello.
Yeah. Yeah.
Am I audible, sir?
Yes, you're audible. So these are
Yes.
the
I have
details.
pinned my link.
Sorry, wait for a minute. So these are the details of Sameer. He is my course manager. You can WhatsApp him, you can email us, or you can follow us on Instagram, YouTube, anywhere. Just talk to us. We'll be very approachable and happy to answer you. So you guys can take a screenshot or picture of this slide, and then I'll stop sharing
Hello,
it.
sir.
Yeah, hi.
I have
Okay,
also
thank you,
shared a
sir.
link of WhatsApp.
Yeah,
Please pin it.
yeah.
Pin it
Uh,
in no chat.
Yes. Harsha?
Hello, good evening.
Yeah, good evening.
So,
Yes, Tanvi.
good evening, sir. So my question was that there are still 20 to 25 days left for this course to begin.
Hmm.
So before that, should we start reading some other book or any other source so that it is beneficial for us
See,
later in the course?
yes. So the most important book I would say is Red Book. It's a very thin book. and I have given it on my Telegram. Just follow Dr. Gupta MD on Telegram. It's available there. You start reading that book. So by the time you start our course, you will be already having something in your mind. Okay, this is Red Book. Red Book is about the guidelines like breast cancer screening, colorectal carcinoma screening. These questions are very important. So in every exam, you'll get at least 1 or 2 questions from these 2 topics. So just go through, and maybe driving restriction and different things. So Red Book, you start with the Red Book, and on 15th, when we'll be having that first class, will be, see, it's not a coaching actually, it's tuition. So we are your tuition teachers, and we're gonna make sure that maximum, I want 100% of you to clear the AMC1 exam in your first go. So I'm a kind of like show off guy, so I want to show off that my students can clear, even if I have to
Okay,
go
sir.
beyond my boundaries to make sure that you guys clear your AMC1 exam with my help.
Sir, one more question.
Yeah.
Say, I am already a pass out graduate, so I wanted to ask that should we start like preparing for a CV as well from now only? Will that help?
See, you can work on your CV, but I don't think it's gonna be much of a benefit, because unless you have cleared your AMC1, CV is not gonna give you any benefit. So right now, just focus on AMC1, because in the coming future, the competition is gonna be higher and higher. So don't waste any time. Just
Okay.
start focusing on AMC1. That's why we had to start this course as soon as possible. And yeah, so once you are clear with your AMC1 on 31st March, then you'll have 1 month with you for your results. In that time, you have to focus on your this CV.
CV.
Yeah.
Okay, thank you, sir. Thank you, sir.
Yeah. So guys, we have 10 more minutes,
Sir,
and yeah,
sir,
you.
do we need good evening, sir.
Sorry.
Good evening, sir.
Good
Do we
evening.
also need to read John Murtagh or anything, or these notes are enough?
Notes will be more than enough. But if you are still want to do some topics from John Murtagh, you are happy to open it. But we will be giving you guys the notes in the classes as well, the concepts from John Murtagh as well as recalls. So everything will be provided. But just for your interest, you can go through your John Murtagh. But I won't recommend going for whole John Murtagh anyways.
Okay, thank you, sir.
Yeah.
Good evening,
I
sir.
have a
I have a question.
Yeah.
Actually, I am I have done my post graduation also from India in ophthalmology,
Yeah.
and after that also I have 2 years of experience.
Yeah.
And right now I'm thinking of preparing for AMC. I want to know what are the chances of someone who has done specialization. What will be the pathway for once I clear AMC? What are the job options I'll be having?
See, you'll be working as a RMO first, because ophthalmology is a very competitive branch. So don't even think about going for specialist pathway. It's very, very hard. So I don't want to be very negative about it, but it's highly competitive. So once you get your first job, then we can revisit your CV and see how we can get your training again in ophthalmology here. Yeah? Yes.
Okay,
Next.
okay, sir. Thank you.
Hello,
Be quick,
sir.
guys. So
Hello,
last
hello,
7-8 minutes.
hello, sir.
Hi.
Hello, sir. I'm a final year MBBS student from
Yeah.
India.
Yeah, Palvi.
I have my final year exam on July. I have a long time period to prepare.
Okay.
So I
Yeah.
thought of preparing AMC along with it.
Yeah, that's great.
So can you tell me what all to prepare? So like prepare my CV or where to start?
At the moment, Palvi, you watched that video on YouTube, how to prepare for AMC while you are a medical student
Yes,
or
yes.
intern. So you watch that. I have given everything. But if you want to join our course, join and make your notes, so that when you are preparing for your final year exams, they'll add on to your AMC notes. So it's gonna be golden opportunity for you to refine your notes, and the knowledge and the topic needs to be done. So it's gonna be very good. Okay.
So, sir, I'll be writing my AMC exam after my internship, which will be in next year, like
Yes. Yes.
2026.
Yes.
So I can do from the same course, right? So
Yes.
same notes that I
So,
have
so
joined.
the thing about this course is we're gonna give you basic knowledge and the concepts that you need to sit in your exam. And rest is revision and recalls. Recalls you're gonna cover day by day slowly, and at last you can join our 5 day session of recalls just before your exam, and meanwhile just prepare your notes again and again, repeat that. That's the thing. So yeah.
Okay, so thank you.
I have a question regarding Epic.
Yeah.
See, I have like made my account. I've made my account on AMC as well. But I'm a foreign medical graduate, and we have met before. If you remember, my name is Raghav.
Yeah, Raghav.
So the thing is, my verification is still showing pending on the ECFMG portal.
Yeah.
But I'm eligible to book my exam.
Yeah.
But earlier before you said that you cannot book once your degree is verified. So if it is not verified, I cannot book my exam.
As far as I remember, I don't think you can book, but if it is showing, I think we can
Yeah,
discuss
see,
it. Raghav, you just send a message on my AMC by Dr. Gupta account, and I'll
okay.
confirm it with the experts and get back to you. Okay?
Yeah, as far as I know, they said that on dashboard on AMC dashboard, they are saying that I am eligible to book my exam anytime now.
Yeah.
But my
then you can.
okay.
Yeah, but we can.
Okay, I'll get.
Yeah.
Yeah, we can discuss it over there. Okay, sure.
Next, guys, 5 minutes.
Hello, doctor.
Hi, Banu. Yeah.
Hi, hope you're doing well. So
Yeah.
I have two questions.
Yes.
First thing, I've graduated from India. So it's been 2 years since my graduation, but the thing is, I've only worked in a small clinic, not in a hospital setup or anything. So will it count as experience to me, or
Yes.
does it
Yes.
only? I mean, I've heard. Okay.
It's all right.
I'm sorry.
So even if you have worked in clinic, you have to show that clinic experience in details, like what all you did in that clinic. So clinic is not bad. It's something like how you present that clinic work for 2 years. So it can be big for you on your CV, like 2 years of experience, or it can be nothing. It depends how you show that, how you present that thing.
Okay,
Yeah.
it's just literally OP only, so I'm not sure if it will
No worries, no
amount
worries.
to.
You were working in healthcare. That's enough. That should be fine.
Okay,
Yeah.
okay, thank you. Another question. So, what chance does an IMG have to get into a surgical specialty or psychiatry specialty after after
Getting a
clearing
job. Yeah.
AMC2 and all of
See,
that?
surgical specialty chances are very rough because of high competition. Psychiatry is somewhat easier because it's medical specialty. For surgical, you might have to work for 2 to 3 years as a registrar in surgical branch, and then you make your links and your CV towards it, and then you can. I have seen people getting it in 2 years, and you can become a surgeon. It totally depends how passionate you are about surgery. Some people work for 3 years and they don't want to work much, and there are no good links or anything. So as far as I know, if you have good passion, you can get it.
So, would you recommend doing a 1 year of residency or non-acad JR-ship in India for
Not in
surgical
India.
branches or?
Just move to Australia as soon as possible, and once you are here, then you can join surgical department. That will benefit you way more than your Indian rotation.
Thank you so much.
Yeah.
Have a good day.
No worries,
Hello.
man. Thank you.
Hello,
Yeah.
sir.
Hi. Yeah.
Hello, sir. My name is Vijay Lakshmi.
Yeah, Vijay. Yeah.
I recently graduated, sir. I'm a foreign medical graduate.
Yeah.
I just wanted to know what is the importance of internship in the registration of AMC 1 or AMC 2, and is it necessary to even if I don't opt for a job after AMC 1, if I continue to write AMC 2, is it necessary? The internship is necessary?
No, internship is not necessary. But if you are applying, you have to apply just for intern jobs, which are, not too many. So you can do is you can also do AMC1, AMC2, start applying for internship job, and you can make your CV strong. And you start from your basic, like as an intern, you'll learn a lot. But if you are taking some time to clear your exams, maybe for example, you're booking your AMC1 in 6 months, then AMC2 in next 6 months, then you'll get a job in 6 months. So why not join your internship now at a very easy, chill area where you don't have to work much and you can study for your AMC exams. By the end of your AMC2 and you get a job, you can apply for RMO jobs, intern jobs, anything. And yeah, you can use that preparation time in your internship.
Okay, so you're suggesting me while my reading for AMC1 and AMC2, I do it here in
Yes.
India.
Yeah, you can start it here, but you can apply as an intern. It's not compulsory, but it's just my suggestion for you.
Okay, okay, sir.
Yeah. Last question,
Thank you so
guys.
much.
Yeah.
Hello, sir.
Hi.
Sir, my question is, do we need any work experience to apply before AMC1 or to write the AMC1 exam? Do we
No.
need any work experience?
No work experience is needed. For your job, it might look good on your CV, but if you are a fresh graduate, it doesn't matter because they know that you recently graduated. So it's not compulsory, but yeah, that for AMC1, you don't need any work experience. You
So, sir,
need
I'm
me.
a graduate.
Hello?
I'm doing my MBBS.
Yeah.
So, do I need the Indian license, sir, to apply for AMC1?
It depends if you have that your college is recognized with APRA. Just check that that site. Just check my YouTube video. So yeah. So rest of you guys, if you have any questions, send it to Samir or message me on AMC by Dr. Gupta group because this call is automatically gonna cut. So I hope this webinar helped you. And yeah. Sorry guys, I
Hello,
couldn't.
sir.
Yeah.
I have sent in the chat.
So one small doubt.
Yeah.
So if our college is recognized in the word dictionary of medical schools, is that enough or it should be recognized in the